Hello, my name is Bonjbol Abiri, and I am thrilled to be speaking to health professionals like you. As a consultant psychiatrist, an adjunct lecturer, and a mental health advocate, I have spent over a decade owning my clinical skills and expertise in the field. My passion for mental health extends beyond my clinical practice. As a professional speaker and teacher, I have championed mental health courses. As a panelist, presented papers at local and international meetings, and explored various forms of mass media to promote a mentally healthy society. I am confident that this specially curated series will be a valuable resource for you as a professional caregiver. After all, caregivers also deserve some care. And so, I warmly welcome you to this session, and I look forward to sharing my knowledge and insights with you. What comes to mind when you hear the words anxiety and stress? Quite often in my practice, when people talk about the words anxiety and stress, it's usually in negative light, as they always think about the fact that stress and anxiety are debilitating, detrimental, and distressing to their health and well-being. It would, however, surprise you to know that stress and anxiety are a healthy and normal part of our lives. While stress is a normal physiological response to a stressor, anxiety, on the other hand, is a normal response to a threat. What we, however, find is that when these conditions become disorders, the individual feels as if their sense of safety and security is under attack. And so while stress and anxiety are entirely normal and healthy, they can become detrimental to the human body when they become chronic and long-lasting. When stress and anxiety happen, individuals usually have certain symptoms that they show up in their minds and bodies. Some of the symptoms that we find in the mind, which is in the cognitive part of our bodies, is that individuals may find that they struggle with paying attention, concentrating, or being productive at their jobs. When stress and anxiety affect emotions rather negatively, what we find is that individuals have problems with their mood, they feel low in mood, they lose interest in formally pleasurable activities, and they also find that their energy just drops. When stress and anxiety affects the physical body, what individuals notice is that they have palpitations, increased respiratory rate, and increased bowel movement as well. When behavior is affected and individuals are under intense stress and pressure, what we find is that individuals may become cranky, unduly irritable, agitated, or may prefer their own company to that of others and prefer to remain alone by themselves. When stress and anxiety happen, to us, especially as caregivers, it is largely because we are overwhelmed with the amount of work that we are exposed to. If we are not overwhelmed by the amount of work that we are exposed to, what we also find is that the resources to cope are not enough to deal with the problem that has been handed over to us. And so while we take care of others, while we watch patients die, or while we watch patients with difficult situations, while we deal with their families, while we deal with the pressures even in our own lives, as caregivers, our physical and mental health may suffer significantly as we endure symptoms and signs of stress and anxiety. To prevent the debilitating effects of anxiety and stress, however, I will recommend that you do the following. Number 1, learn to identify your triggers and your stressors. This is one of the most effective steps because sometimes our triggers and our stressors may just be ourselves, maybe people in the environment, or maybe the processes that we engage in, day out. Number 2, it is important to focus on what you can control. As humans, a lot of our energy is spent thinking about and focusing on what it is that we can control. This is largely detrimental to our health and well-being, and of course, fuels our stress and anxiety. Number 3, it is important that we engage in exercise, as exercise has been noticed and known to help us release what is called our feel-good hormones, endorphins. Exercise also helps us to ensure that our physical and mental well-being are top-notch. Number 4, it is important to get adequate rest, relaxation, and sleep, as our bodies will be healthier if we learned how to rest, relax, and get quality sleep. Number 5, we must ensure that we eat healthy at all times. We must make sure that we eat to feed our bodies, not to fuel our emotions. Number 6, it is important that as humans, we socialize with our family and friends and try to keep in touch with people, as isolation and loneliness can further worsen stress and anxiety. Number 7, it is encouraged that we keep a journal every day, a gratitude journal in which we write not just what we are grateful for, but why we are grateful for these things. As caregivers, it is extremely important that our mental and physical health is top-notch at all times. Anxiety and stress, especially if chronic and long-lasting, may not, however, put us in the best frame of mind to be able to cater to our patients, our families, and even ourselves. Our worries, stressors, and anxieties may not go away. And so, if you find yourself in this situation where your worries, anxieties, and stress keep you in an unhealthy state of mind, I will recommend that the caregiver also sees a professional. Remember that there is no health without mental health.